Hi, welcome back to my channel. Sorry this is a bit, as I was trying to film this, I got told that my class for the next 3 weeks is canceled. As a student and not an EMT, I just want to guys, beware. There's a lot of people working in the emergency departments and in hospitals, and those in medicine, especially in emergency medicine, are still working, and just try not to get sick. Again, I know this is all over social media, but with the coronavirus, with COVID-19, you want to try to stay away from others, avoid really crowded places, make sure you always wash your hands, try not to touch things that are in more communal places. And again, it's not a time where just because you don't have class, you don't have certain things, you might not have work, you're supposed to stay home, doesn't mean you go out to a bar. I was driving around Richmond and I saw people out at bars. That's just completely the opposite of what you're supposed to be doing right now. Anyway, I did want to answer, I know on my last video I was talking about sort of an update just with class and what I'm doing right now and stuff. I wanted to kind of answer some questions. So I'm going to do that. If you're interested in EMT, what EMS does, and the process of becoming an EMT, all that kind of stuff, keep watching. EMT, that just stands for Emergency Medical Technician, and it is kind of that, but a lot more. So to answer what an EMT is, a few people ask that. EMTs are kind of the basic, and they are in charge of basic airway management, cardiopulmonary resuscitation, CPR, bleeding control, bandaging, any kind of intervention that's going to stabilize the patient so that they don't die on their way to the hospital or wherever they're going to go. And medical services, the whole process before that, the reason National Registry exists, the reason that EMTs and paramedics exist is because a lot of people were dying or not getting emergency care when they were in life-threatening situations. So a lot of car accidents, a lot of things like that, no one would be there on the scene to help them, and there were a lot of deaths as a result. So in 1966, there was this report called Accidental Death and Disability that kind of came out, and it was titled the neglected disease of modern society, and it showed the inadequacy of pre-hospital care and how nothing was being done to people that were in a critical condition, whether that was shock patients or those dealing with a stroke, all those kind of severe traumatic injuries, blunt trauma, stuff like that. They weren't getting any adequate care, so there were a lot of deaths just because of that gap between some incident happening and being able to get to the hospital and be in the hospital. So then in the 1970s, 80s, that's when it kind of transitioned, and they tried to make a more uniform system to help reduce those numbers, and then hence EMR, EMT, advanced EMT, and paramedic were established. 45% of emergency services is also done through the fire agencies, 20% is non-fire governmental agencies, and then 25, so a quarter of it, is private still, and then 10% is hospital/Native American tribal services. There's an emergency medical dispatch, you call 911, it goes through the sheriff's department, and then it's the sheriff's department that calls them and tells them this is the call, this is where it is, and then you're the first responder. To answer the questions in regards to what my class has been like, I'm in a hybrid EMT class, and it's once, twice a week, depending, Thursday nights, and then sometimes Saturdays all day. And it's pretty intense. You learn kind of everything, the basics. You first, before you even start the course, you have to do basic life support, so getting certified for CPR and things like that. And in terms of what you're trained on, anything that could be a medical emergency, anything that could also be a trauma emergency, and those are split up between medical would be someone's experiencing anaphylaxis, and you have to be able to identify that, which is an allergic reaction to where they cannot breathe, and then be able to treat it, administering an EpiPen, stuff like that. Trauma would be someone falls off a cliff or something, and stand by, like a bystander calls 911, you have to be able to stabilize whatever broken limb they have and get them on a stretcher, get them to the ambulance. So those are kind of examples of what you do. Yeah, in terms of the course, it's knowledge regarding all of that, treating any kind of condition that you could kind of come by. So it is a lot of information. I found it very, very tough. You want to know how the body functions and stuff like that. So if you don't have that information already, you kind of are going to learn it throughout the whole class, and then also be able to apply it to a real world situation, which is pretty cool, but definitely makes it a lot of material to learn. We do like 4 chapters every single week and are tested on them every single week. So it is pretty fast paced. You are required to do clinicals, which is clinical rotations. It's similar to like if you're in a nursing program or if you're in medical school, you have clinicals, which is essentially it's a little more than shadowing. With the EMT course that I'm in, the ride-along, it's called ride-along or riding with the EMS. You do have to get liability insurance just because you are helping. My first call ever was someone with respiratory distress. They had COPD, that kind of stuff, and I got to administer different medications. You know, you do put patients on oxygen, you do administer certain drugs with the supervision of a paramedic or an advanced EMT, another EMT, whoever you're riding with. That's required. You have to have, at least for my program, a minimum of 10 different transports to be able to get certified. Like, you do have to pass the course, but then to actually become an EMT, you have to pass the National Registry exam. Part of it is online in a testing center, just done through a computer, and it's, you know, all kind of questions on all the different topics you learned about throughout the entire course. And then the second is your psychomotor exam, so you're getting assessed. One of it is with a medical situation, one of it is a trauma situation, and then you're tested on any kind of random skill that could be bleeding control, any kind of trauma, splinting, things like that, and you don't really know what you're gonna get. With EMT, that's like the basic. Well, I guess the EMR is basic, but if you want to be a paramedic, you have to start at EMT and then go into do a paramedic course, or you can go from an EMT to an advanced EMT to then a paramedic. It just kind of depends on what your program is and what you go into, but that's kind of how it works. And then you have, once you're certified, you can then try to apply to jobs in whatever county you're interested in. Again, I can go into more detail. That's kind of the basic of it. If you have any questions or want to know more, feel free to message a comment. I respond to every single comment, so feel free to do that. Like this video if you found it informative, and please stay safe, stay clean, and stay updated. I'm gonna link the CDC if you're interested in the updates with the coronavirus. And I just think a lot of people are getting information that's not necessarily accurate, and a lot of people are freaking out, and that doesn't really do anything. You want to be alert and aware and not panicked and not anxious. So yeah, let me know how you're doing. I'm gonna be streaming more just because I don't have class now, so I can actually go and do that. So if you want to follow me on Twitch, I'm going to link it below as well, and you can play a game with me. Yeah, thanks for watching.